If you have Medicare or you're about to turn 65, I need you to watch this entire video because every year Medicare changes. The premiums change, the deductibles change, the rules around your prescriptions change. And if you don't know what's different for 2026, it can cost you real money, sometimes hundreds of dollars you didn't plan for. The Centers for Medicare and Medicaid Services, known as CMS, released the official 2026 numbers in November 2025. I've gone through all of it, and in this video, I'm going to break down exactly what's changing in plain English with no confusing jargon. By the end of this video, you'll know exactly what to expect on your premium statements this year, and a few ways to potentially save money. Let's get into it. Change number 1, and this is the big one. Your Part B premium is going up. The standard monthly Part B premium is rising from $185 to $202.90, an increase of just under $18 a month. CMS says this is mainly due to rising healthcare prices and increased use of medical services. Now, here's something important. Part B covers your outpatient care, doctor's visits, preventative services, durable medical equipment. This is the premium most beneficiaries pay directly, often deducted right from their Social Security check. If you're on a fixed income, this increase matters. It's worth checking your exact Social Security deposit this January to make sure your budget accounts for the change. Change number 2. The Part B annual deductible is also going up. This is the amount you pay out of pocket each year before Medicare starts covering its share of your Part B services. It's rising by $26, from $257 to $283. If you have a Medigap supplemental plan, this deductible is often covered for you, so check your specific plan. But if you're on original Medicare without supplemental coverage, you'll want to budget for this amount early in the year, since many people hit this deductible during their first doctor's visits of the year. Change number 3. If you're ever hospitalized, Part A costs are increasing too. The good news for most people, about 99% of Medicare beneficiaries don't pay a monthly Part A premium at all because they've worked and paid into Medicare for at least 40 quarters. But the deductible you'd pay if you're actually hospitalized is increasing to $1,736, up $60 from last year. This is exactly the kind of cost a Medigap policy is designed to help cover. If you don't currently have supplemental coverage, this is a good year to compare options during open enrollment. Change number 4, and finally some genuinely good news, prescription drug coverage. For the first time, Medicare negotiated prices directly with drug manufacturers under the Inflation Reduction Act, and those negotiated prices take effect in 2026. If you take blood thinners like Eliquis or Xarelto, or diabetes medication like Jardiance, your out-of-pocket cost on these specific drugs could drop significantly, in some cases by more than half. The insulin cost cap also remains in place, $35 a month maximum, regardless of which insulin you use or whether you've met your deductible. The one thing that is increasing, the maximum Part D deductible is rising slightly, from $2,000 to $2,100. But here's the key part that hasn't changed. Once you hit that out-of-pocket cap during the year, you pay $0 for the rest of your covered prescriptions. That protection, created under the Inflation Reduction Act, continues into 2026. Change number 5 is specifically for higher income beneficiaries, something called IRMAA. IRMAA stands for Income-Related Monthly Adjustment Amount. If your income is above a certain threshold, you pay more for both Part B and Part D, and these thresholds are adjusted for 2026. This is based on your tax return from 2 years ago. So your 2026 premium is determined by your 2024 income. If your income has dropped significantly since then, due to retirement for example, you can actually request a new determination from Social Security using what's called a life-changing event form. This is a step a lot of people don't know about, and it can genuinely lower your premium if your circumstances have changed. Change number 6. If you're on a Medicare Advantage plan, a few things are shifting. The maximum out-of-pocket limit on Medicare Advantage plans is actually decreasing slightly for 2026, a small win for plan holders. But CMS is also tightening the rules on certain non-medical extra perks, things like grocery allowances and utility credits that some plans previously offered. The value-based insurance design pilot, which funded some of those benefits, officially ends on January 1st, 2026. If your current Medicare Advantage plan included extra perks like this, it's worth a careful review during open enrollment to see what, if anything, has changed for your specific plan. So with all of that, what should you actually do this year? Here's a simple checklist. And remember, your local state health insurance assistance program, or SHIP, offers completely free, unbiased counseling to help you review your specific plan. This is a free resource that very few people take advantage of. Medicare 2026 Key Changes. Part B premium $185 to $202.90. Part B deductible $257 to $283. Part A hospital deductible $1676 to $1736. Negotiated drug discounts on 10 major medications. IRMAA thresholds adjusted for higher earners. Medicare Advantage extra perks being reviewed. Medicare doesn't have to feel confusing every year. The numbers change, but once you know what they are, you can plan around them with confidence instead of surprise. If this video helped clear things up, please give it a thumbs up. It helps more people get accurate, current Medicare information instead of confusing or outdated advice. And if you want more honest, practical videos about Medicare, retirement, and protecting your financial future, subscribe to Money Quill. We break down exactly what matters every week in plain English. Take care of yourself and your coverage.